Yes, please. I've had my eye on that all morning. Okay, you guys, right now we are sitting down with Dr. Brian Loveridge. He's the Chief Medical Officer with Diabetes Relief. The objective here is to let people know that there is an option for really kind of getting control of those symptoms, talking about type 1, type 2, so much more common than we realize.
Absolutely. Most people don't realize that in America, 1 out of every 3 adults is either diabetic or pre-diabetic. And 25% of all the healthcare dollars that are spent in the U.S. are spent on diabetic patients.
I had no idea. And again, we're talking about both types.
Exactly. Yeah. In 2017, $327 billion was spent on diabetic care, and they're projecting by 2030 that'll be over $600 billion.
Wow.
And even more concerning, diabetes puts you at substantially higher risk for developing COVID. So it's an important thing to think about.
Okay, now what exactly is it for those who don't know? It's the body's inability to break down sugar?
Right, and so since 1922, doctors have used insulin to suppress the symptoms of diabetes. We use an IV infusion of insulin where we're using insulin as a hormone communicator. So basically we're using insulin in a physiologic manner to improve insulin sensitivity, improve carbohydrate metabolism so that the body has the energy stores necessary to heal and regenerate damaged tissues.
Now, how is that different from other treatments that have been attempted out there?
Yeah, we're basically trying to get to the core problem, which is insulin resistance. So rather than just suppressing symptoms, we're looking to actually improve metabolism and the body's ability to break down that sugar so that you have the energy necessary to heal and revitalize your body.
Let's talk about what your patients are experiencing and the changes that they're seeing.
Yeah, it's pretty dramatic. So, I mean, we have several patients who've had significant improvements in their overall health, improvements in their A1C, improvements in energy level, diminished neuropathy, improved kidney function. We have one patient, Mary Ann, who in the last 9 months, she's lost 70 pounds. And it's all because what we're doing is we're helping the body have the energy necessary to heal and really start to, improve so that we're not just putting a Band-Aid on the problem.
Is this Mary Ann here?
Yeah, this is Mary Ann. She's one of my favorite people and I absolutely love her. And because the energy levels have improved so dramatically, she now feels, she wants to get out and go on a walk. She wants to go out and do things rather than just be stuck on the couch all day. And so she's been able to lose 70 pounds. Her neuropathy is better. Her kidney function is better. I mean, she basically has told me that Diabetes Relief has literally added years to her life. And so it's really rewarding as a clinician to be able to make such a positive impact for our patients.
So who is a good candidate for this? Children, all the way through adults, pre-diabetic?
So, pre-diabetes, type 1, type 2 diabetics who have complications of diabetes. So if you're doing standard treatment modalities and it's really, you're still developing neuropathy and kidney problems and all of these other opathies of diabetes, we're just we're one more arrow in the quiver for your clinician to throw this into the mix to really make a positive change for your disease.
Now, do people give up their regular care physician, or is this just something in addition to?
Absolutely. So no, we work in tandem with clinicians. We want to add one more tool to the mix so that you can more effectively combat, the complications that diabetes causes.
This sounds incredible. So I know some people that are pre-diabetic right now in my family, and this sounds like something they need to do to really jumpstart their road to getting a handle on their health. Where can people find out more?
Yeah, so you can visit us online at diabetesrelief.com. We have a Facebook page, Diabetes Relief Layton. And if you want to call and ask any questions, feel free to call at 515-4100. We'd be happy to set up a consultation, answer all your questions, and help in any way we can.
Perfect. Thanks so much for being here, Doctor.
Thank you. Appreciate it.
Up next.